Hey guys, I'm here today to talk about the difference between hearing aids and tinnitus maskers. If you have tinnitus, you've probably asked yourself, should I be using tinnitus maskers on my ears, or would a hearing aid be more effective? That's a great question and an important one. Both tools can be helpful, but they serve different purposes. Today I'm going to explain what is the difference between hearing aids and tinnitus maskers. I'll also explain the right choice, and depending on your hearing profile, the severity of your tinnitus, and the situation in which tinnitus bothers you the most, we'll be able to decide which of these is the right fit for you. My name is Dr. Ben Thompson, audiologist and founder of Treble Health, a nationwide private practice specializing in tinnitus care. My team and I have worked with thousands of patients successfully treating tinnitus, and here on our YouTube channel, we're trusted by over 150,000 subscribers for honest, evidence-based advice on tinnitus management. So let's get started. First, let's talk about hearing aids, and I have the ReSound hearing aids in my hand right here. It's one of the manufacturers that makes hearing aids. On my right side, I have the Widex SmartRick devices. Now here's the kicker. Both of these devices could be used as hearing aids and as tinnitus maskers. Why is that? Well, that's because the design, the hardware of these devices is not going to change whether or not you're turning on the tinnitus features, all right? So first, let's just talk about hearing aids. A hearing aid is a medical device that can help tinnitus by amplifying external sounds. That includes amplification of voices, environmental noise, and many of the everyday sounds you may not even realize that you're missing. This amplification helps your brain better process what's happening in your surroundings. Now here's something that surprises many people. Even though hearing aids are primarily used to address hearing loss, they can also help significantly with tinnitus. By restoring natural sound input, hearing aids reduce the contrast between your tinnitus and the quiet environment where your tinnitus bothers you. That's because you're hearing more of the sounds that you're missing. The high-pitched loss of hearing creates the high-pitched tinnitus, and then bringing back more of that high-pitched natural sound reduces the awareness or the intensity of the high-pitched tinnitus. When your brain receives more of that external sound, it often pays less attention to the internal ringing caused by tinnitus. Many modern hearing aids also come with built-in tinnitus features such as customizable white noise or relaxing, soothing sounds. Those can be tailored and custom programmed to your preferences to give you the most relief. That's someone like me, an audiologist, who would set them up on your ears and fine-tune them to get you the best relief and ultimately the best treatment for tinnitus and potentially hearing loss. So in short, hearing aids, which this is my example of hearing aids for today, these are often a two-in-one solution for people who have both hearing loss and tinnitus. Now let's look at tinnitus maskers. I'm just showing another type of device here. We often use these devices as tinnitus maskers at Treble Health. Unlike traditional hearing aids, tinnitus maskers are typically only sound therapy. They do not amplify sound or correct hearing loss. Many people say tinnitus maskers. That is a common phrase that's used. However, I believe the appropriate term is sound therapy devices. These would be devices worn on the ears that do not rely on the hearing aid amplification settings. So it's best for someone who has more normal hearing or doesn't have a hearing problem. The primary function of these sound therapy devices, also called tinnitus maskers, is to play soothing background sounds called sound therapy. That can be white noise, shaped noise, or even soft tones, like in these Widex SmartRick devices. Our patients get a lot of relief with the various sound relaxed tones, formerly called Zen therapy or Zen tones, that can help reduce the perception of tinnitus for the individual. Those sounds work by blending in with the tinnitus. So that's actually what masking really is. It's the sound therapy below the tinnitus mixing in with the tinnitus. We're not trying to fully cover the tinnitus. Frankly, for most people, that's quite hard. And also, that's not how this system should be used. Tinnitus retraining therapy, for example, shows us the specific place to set the sound therapy, and we're never completely masking it or covering it. These sounds work by blending with or masking the tinnitus, making it less noticeable. One of the great benefits of sound therapy through tinnitus maskers or hearing aids is that the sound therapy can provide some immediate relief. So when you have it on, it helps reduce the awareness of tinnitus, especially in quiet environments. But the real kicker and the real reason we use it for many patients is because during a tinnitus treatment, we want to reduce the baseline level of tinnitus. So even at the end of the treatment, when we're no longer wearing these devices on our ears, the individual has less tinnitus. And at that point, they would not need to use the daily sound therapy as part of their treatment plan. This effect can provide temporary relief, especially in quiet environments. Guys, what's really interesting is that typically the tinnitus maskers have the same hardware as the hearing aids. That's what I said before, I'll say it again. That's right, they look the same as hearing aids, but the doctor, you'll see, the audiologist would program and set them up differently so that they function just as sound therapy devices worn on the ears. Maskers are especially helpful for people who have normal hearing but still find their tinnitus disruptive. We use sound therapy devices regularly with our patients at Treble Health. So how do you decide which option is best? Well, here's a helpful way to think about it. If you have hearing loss, even if it's mild, a hearing aid with tinnitus features and amplification turned on is often the most effective starting point, and it's what we see the most success with for our patients. You'll get the most tinnitus relief because you have the sound therapy working for you and the hearing aid amplification working for you as well. That's best for people who have a tinnitus problem and a hearing problem, all right? But many people have a mild hearing problem and they primarily have a tinnitus problem. We are recommending and seeing the most success with these types of hearing devices on the ears programmed with sound therapy and with some of that amplification. If you have normal hearing but are struggling with tinnitus, then a tinnitus masker, these sound therapy devices worn on the ears, is a great choice. It may just look like a hearing aid, but the settings and the programming is different. And that's best for people who only have a tinnitus problem and do not have a hearing problem. So both options have their advantages, right? Hearing aids offer amplification. Both of these types of devices support long-term habituation, the treatment of tinnitus. With hearing aids and the amplification turned on, then the patient typically undergoes tinnitus treatment with the sound therapy and the amplification on at the same time. But then once the tinnitus is reduced, the audiologist then uses the hearing aids just for the hearing loss. So we turn off that consistent sound therapy program and we just have the individual use the devices for the next 5 years or so, because that's about how long hearing aids last. They use those hearing aids and they just use them for treating the hearing loss. The tinnitus is much better. With tinnitus maskers, the patient would typically stop using the tinnitus maskers after the tinnitus treatment is completed. What we find at Treble Health, remember, we're seeing a high volume of patients with our Treble Health program and working with our doctors. A vast majority of our patients are using our hearing aids or tinnitus maskers with significant reduction, with success. So they're having a successful outcome in their tinnitus. There's absolutely something that can be done. That's a big message that we have here for all of you listening. So both of these devices are discreet, effective, and they're supported by clinical research focused on habituation and tinnitus retraining therapy. We want to get the patient relief, and then we want to reduce the baseline level of tinnitus over time. All right, so to choose the right solution, let's start by asking yourself the following questions. First, do I have measurable hearing loss? When I got the hearing test, what did they tell me? Candidate for hearing aids or not? Second, is my tinnitus more noticeable in quiet environments, such as when I'm at home by myself or when I'm working in an office? Next, do I have trouble hearing people, particularly in group settings or noisy places like a restaurant? And have I tried any form of sound therapy before? Was it helpful? If you answered yes to both the hearing and the tinnitus-based questions, then a hearing aid with built-in sound therapy is likely the best starting point. However, if your hearing is normal and tinnitus is only your concern, you don't have trouble hearing in restaurants, you don't need a hearing aid, then a tinnitus sound therapy devices, also called tinnitus maskers, may be the best fit and more suitable. All right, guys, so if you're looking for a place to start, that's exactly why we offer the free consultations where you can speak with a specialist from my team at Treble Health. We'll include that link right here, and you can look below in the description where you can have a conversation with someone who specializes in tinnitus, and we can direct you towards the best solution that's right for you, whether it's hearing aids and tinnitus maskers or something else like CBT, counseling sessions, coaching, guidance, specific apps, sound pillows. If you're having trouble with sleep, we can help you out with all this by checking us out and booking that free consultation. We're here to help. Find us on the screen right now to book your free call, or you can watch our next video where I guide you through the 4 stages of tinnitus relief, also called the 4 stages of habituation. Check that out on the screen right here. My name is Dr. Ben Thompson. I wish you well, I wish you peace, and I'll see you in the next video.